Now we'll welcome Sheila Priestley and Leanne Berkey of Novant Health's physical therapy team. Sheila, Leanne, thank you so much for coming today. It's a pleasure to have you.
Thank you for having us.
Sure. Now, I'm excited to hear what's going on in physical therapy with the Novant Health physical therapy team. So, for our viewers who may not have met you yet, let's share a little bit about yourself and your role with Novant Health. And we'll start with you, Sheila.
Okay. My name is Sheila Priestley. I'm a physical therapist. I've been a physical therapist for 17 years.
You don't look old enough.
Oh, but I am. But I am. I just turned my new decade. And I am the rehab supervisor for both inpatient and outpatient. So obviously our inpatient is here at Novant Brunswick Medical Center, and we're going to have we have our clinic in Sheila and a new one coming soon in Calabash. So we're looking forward to that in the fall.
Yeah.
Yep. Looking
Great.
forward to it.
Yeah. Sounds awesome. How about you, Leanne?
Well, I've been in the field for 27 years, and I just want to say about our team, I am impressed with how we genuinely care for our patients, and I love the background. Stephanie is a PTA, and Kelly also, and they all bring a wonderful background of nursing and orthopedics, pediatrics, and Kelly's a yoga instructor, so it's wonderful that we have that well-rounded care in our outpatient center.
So you're both physical therapists, but I understand that you have aides there also. Can you talk a little bit about that?
Sure. We have PT assistants at both our inpatient and outpatient sites. We have 2 full-timers and a few PRN assistants, all skilled in all aspects, both orthopedics, our balance, our geriatrics, our neuro patients. So they're there to help carry out a lot of the plan of cares, our treatments.
Well, it sounds like you both have significant experience, but let's start with the basics. Tell me where all of the Novant Health physical therapy services are located.
We have our inpatient at the hospital in Bolivia, and we have our outpatient clinic in Sheila on Main Street near Walmart. It's 4503 Main Street in Sheila. And our Calabash office will be right off of 17.
At the New Carolina Shores
right in Carolina
office.
Shores.
And when do you expect that to open?
Fall of this year.
Fall, okay. So do you both offer inpatient and outpatient services?
We both do them,
Yes.
but we primarily, Leanne is at the outpatient clinic right now in Sheila. I float back and forth, but I've been kind of as a supervisor at the inpatient side. So,
So you're at the hospital primarily?
More so, yeah.
So tell me what types of physical therapy services are offered at both inpatient and outpatient.
Okay.
Mostly outpatient. We do anything from orthopedics to neurological cases. We see pediatrics for various maladies, and I was recently certified in balance management and assessment at the American Institute of Balance. So we treat anything from Meniere's to the acronym is BPPV, which means positional vertigo. Yeah, a lot of people get vertigo.
So if I'm just kind of dizzy or having spells like that and I lose my balance, that would be a reason to have the balance.
Sure, June. And a lot of times if it's just positional changes, we can change that in
like sometimes when you stand up
minutes.
too fast.
Right. We'll take a look at all
well,
that.
that's good. Well, how about on the inpatient side? Then what services do we offer at the hospital?
Inpatient has just a little bit of everything, the big mix. We have our, our typical orthopedic surgeries, our general surgery patients, any medical. We have a lot of our geriatrics, respiratory disorders, our neurological patients, whether it's Parkinson's or stroke. We have a whole array that we cover. Our fall patients, dementia patients.
When I think of physical therapy, I think in terms of hip replacements, knee replacements, but it sounds like you treat specific conditions also. You just mentioned stroke or dementia, things like that. So I guess it is a bigger.
It depends on the need of the patient, you know, and a lot of the times the physicians will go in and they'll evaluate a patient that may come in for generalized weakness, falls at home, you know, and such like, you know, so we'll just go in and do our basic assessment, find out what the patient's needs are and treat them accordingly. So
Sheila does it all.
Leanne, what would you say the most common condition is that you treat?
I would have to say it would be lumbar pain, low back pain.
Oh.
We get a
Yeah.
lot, especially with the amount of golfers in our area, young and old. We get all ages. And next from that, I would have to say balance
Really?
issues, dizziness issues, vertigo. And
Oh, that's interesting.
yes.
And how about on the inpatient side? Is there one that stands out? I think there's a fair amount of orthopedic surgery
I was
there,
going to say
so-
definitely with our surgeries because we're full of orthopedics in this county, but definitely I think falls are a big thing because that's where a lot of our older population are coming into the emergency room, so we're getting a lot of falls. But I think, you know, that whether they're stroke or mini strokes, the TIAs that come through, and we have the respiratory disorders and a lot of the COPDers too. Yep.
Does physical therapy require a doctor's referral?
We have direct access, so not necessarily,
Not
but a lot of the insurance companies require
that?
it for reimbursement and payment. So if it's something out of our scope of practice, we refer them to a doctor, but typically we do recommend it regardless.
Well, if viewers of ours would like to schedule an appointment or need more information if they have questions, what would be the best way to access you guys? At the hospital, perhaps, or?
Probably directly to the outpatient clinic. They
Okay.
can call, and the number is 910-721-3157. And they can, you know, if they need to.
Would they need to speak to, for instance, Leanne or?
We do have ladies that answer the front desk, so they will be the first line there too. And if at all, if they needed to contact and speak with Leanne, they could request to
Because
do
if they
so.
just have questions about, you know, I think I might need this, you might be the better person to talk with. And so, and again, that phone number was?
910-721-3157.
Great. Well, thank you so much for coming today. It's been a pleasure to have both of you. I'm interested in learning more about that balance thing. So
Okay.
It's up and coming, and we're trying to grow that too. And we'll be offering a lot out there for the community. I mean, we're going to be touching upon a lot of things and looking further to with training and different modalities and things like that to provide to the community. So
Great.
looking forward to it.
Well, thank you both for being here today.
Thanks
It's been
so
a
much,
pleasure,
Jean.
and I hope to talk with you soon.
Thank you.
You're welcome.